we'll have on the parallel session, we have optimizing helmet product development to overcome market challenges with Yu Cho Hung and Marcos Shao. And on the main stage, we will have next generation improvement in healthcare. So I have here on the stage, Denise and Alok. The stage is yours.
Thank you. Thank you, Chris. Thanks for the introduction. I suppose we're, just over halfway through the 24 hours. Actually, I've got no idea where we are, but whatever that means, we're going to probably just change pace a little bit. Today's session is really one of adaptation. The session on next generation improvement in healthcare was presented at the Lean Healthcare Academic Conference in September. And we had a great opening session, which really challenged our audience about what next generation improvement might look like. I'm going to hand over and disappear now to Dr. Alok Patel, who is a real doctor, but he's also a real personality in terms of entertainment. And I'm sure we'll get to experience his mantra today that healthcare is humanity and humanity is entertaining. So over to you, Alok.
Denise, I appreciate the intro, and you set an unfortunately high bar, but it is an honor to be here. Yes, I am an actual physician, so I have a sincere respect and appreciation for everything that's being represented right now with Lean Global Connection and how all of us are collectively sharing ideas, insights, and unique perspectives from all of our institutions across the world, which, by the way, I saw that there's 120 countries or so represented in this conference, which is amazing. And I'm hoping that we can have a free-flowing conversation throughout this session as we talk about improving efficiency, decreasing waste, and putting patients above profits and everything else as we create a more lean healthcare system. So with that, let me introduce some of our all-star panelists who, you'll get to talk to them intimately one by one as we move on. But we have Dr. Terry Plakchek, who is a pediatrician and the Vice President for Performance Improvement at Stanford Children's, Jane Evans, Group Manager of Improvement and Experience at St. Vincent's Health Australia, Colin James, Patient Care Manager at Stanford Fertility and Reproductive Health at Stanford Medicine Children's Health, and Jakaria Stewart, who is the Director of Improvement Team Strategic Programs, also at Stanford. So thank you all for being here. And one important note is, I wish we were all in person and we could be having a Socratic discussion, but I want to encourage everyone to please use the Q&A in your Zoom to ask us questions about what we should be thinking, what should our speakers be thinking when it comes to next generation improvements in healthcare, and what are your specific views in what our guests are going to be presenting? Do you agree? Do you disagree? Do you have further questions? And how should we all adapt? And how do we need to adapt improvement when it comes to looking at healthcare regarding our patients and our staff? So please use the Q&A and ask us everything. So with that, without further ado, Terry, let's bring you up with a very fascinating and entertaining slide as your background.
Thanks, Alok. It's a real pleasure to be here. Thank you so much, Denise, for inviting me. Thanks, Alok, for facilitating us. I have the great pleasure of working with Alok at Stanford Children's as a pediatrician when he's not on the news teaching various Americans about whatever's current in medical practice. This picture is a baby, and I've been doing performance improvement at Stanford Children's since 2010, and have been about 20 years in thinking about how lean applies to healthcare. And so, as one of my mentors, Jack Billy, says, much of lean adoption in healthcare is kind of like a sine wave. We go up, we go down, we go up, we go down, but hopefully the trajectory is in the right direction. But, we're talking about what's the next generation in improvement. And I have to say, I'm excited, but I also have some trepidation. And the trepidation is, I don't want to throw the baby out with the bathwater. It's so often that we engage in some sort of improvement and we think, yes, we're doing something that's better. And we talk about those PDCA cycles, and the checking is just, we don't always do it. And so we end up putting something new in because we think, oh, we need to do this, and a lot of people put a lot of work in, and the new thing is not necessarily better than the old way, or it might be better in some ways, but we've lost a lot of the good stuff. So I'm excited about next generation improvement, but I'm here a little bit as that old guy, staring at the clouds and raising my fist and saying, there's some good stuff. Let's not lose the baby with the bathwater.
Terry, I do want to know if you think that "don't throw the baby out with the bathwater" is a globally recognized phrase across the world, across all of our 10,000 or so participants. But I do want to ask you one quick follow-up question is, where in your journey did you start to see that we need to cut out some of the solutions in healthcare, and that there is this kind of need to look at an improvement and say, well, we need to cut out some of it? When did this happen for you?
I'll say the most one that's prominent in my mind. I'm remembering journey boards. My friend Jane and Denise here from Australia, a lot of work in the mid-2000s in Australia on journey boards and how we can visually see how patient care is progressing. Well, those boards were manual. And then we had an entire generation that moved on to electronic health records. We were getting really good at doing this in an analog fashion. And in a conversion, we're going to do better. We're going to put this on electronic health records, which was further, in COVID was even further pushed along because a lot of us were virtual. We lost a lot of great stuff. We lost a lot of discussion that was happening. We lost some countermeasures we were putting up. There was more we could visually see things if you didn't have to go to a computer and pull things up. I could go to a unit that my colleague and friend Colin James was on. I could see where his patient was up to without having to go either into a computer and ask or have to go and ask him. So there was really great stuff that we had through the way we were managing, and we changed because we felt that we needed to bring in the technology in this case. There was good stuff that came out of it, but we lost so much other stuff. And the challenge isn't that the thing happened. The challenge is we didn't immediately correct. We weren't adjusting. We weren't checking and adjusting.
Muted. Thank you, Terry, because I think checking and adjusting is how we can eliminate waste, such as bathwater, while keeping the precious baby in it. This analogy, I don't know how long you're going to run it, but I appreciate it. I think you make a very salient point. And I do have some follow-up questions for you, but we can say that towards the end. And another reminder for everyone out there is to use a Q&A. Light it up if you have questions or comments. I'm going to bring in our next speaker, who also has a very entertaining and dramatic picture. I don't know if Europe is still awake right now, but if you're not, this will wake you up. Jane Evans, would you please explain what this picture means?
I will. Thank you, Alok. And again, like Terry, I'm very, very excited to be asked to be on this very illustrious panel. So thank you, Denise. We were asked to be provocative about how we can influence the next generation improvement. And this is my provocative slide. And I want to follow it up with: healthcare burns money all day, every day, regardless of where you live. And if that's not provocative enough, to follow that up, we know that 30% of what we spend in healthcare every day does not add value to the patient, the organisation, the community, or the population. So we're metaphorically burning money on activities that do not add value and therefore are classed as waste. Just like that bath water that we tip out every day from the baby, we spend money on things that don't add value. And so that is an opportunity cost for us, that if we can identify the waste, remove it, collect it, we've got up to 30% of money that we can actually reinvest in healthcare. And we know that in today's environment, that is an absolutely critical thing, because we cannot stop increasing how much we spend from government. If I asked every person who's on this call and on this panel, if you could name 3 wastes in healthcare, I bet you could do it without even thinking very hard. And as part of my PhD research, I went and interviewed 56 senior leaders from around the world, from different health systems, and asked them if they could name waste in their healthcare, and they could do that instantaneously. And my favourite comment from all of the interviews, and it may or may not be from somebody on this panel, said, "A wise person once told me that if you walk through a healthcare system and you learn to see the waste, you realise you're swimming in it. It's dripping off the walls." So if we know where it is and we can see it dripping off the walls, And we also have the methods to reduce waste through our fairly mature improvement programs these days. Why do we not do it? We don't have a knowing problem. We must have a doing problem. And so I would challenge everybody here for next generation improvement to target waste, but more importantly, to target the measurement and collation of that money that you are not spending on what activities that don't add value, so that we can collate it and reinvest back into healthcare to serve our populations. Thanks, Alok.
Jane, thank you. And, you know, I saw some emojis of hands clapping, and I do want to encourage people to share some experience from your own countries and institutions about Jane's comments and 30% of costs not being directly related to patient care. I don't want to get in trouble, but I will tell you in the United States, it might be even higher than that by a long shot. And so it would be interesting to hear unique perspectives. Jane, I had one follow-up question for you. What do you feel are some of the barriers? You know, you painted this picture of a sci-fi movie with waste dripping on the walls. I can see it. What do you think are the barriers where you are in terms of addressing and eliminating some of that waste?
That's a great question, Alok. And I think there are social barriers around our behaviours, our accountability, our financial literacy, our improvement maturity are some of the social barriers. Some of the technical barriers that stop us are our accounting systems, both technical systems and the way we do old-fashioned management accounting in healthcare. And we also have our political cycles and are absolutely critical to. This is a long-term game to change the culture and the way we do this. And with the short political cycles, to think about particularly financial accounting in a broader sense, I think is a really, it's going to take a really courageous government to go down that path. And I'm not sure politically anybody's got the will to do it, even though they're happy to keep spending the money on waste and burning it.
But it starts with the conversation, which is what you're doing, Jane, because I feel you. I feel you on the frustration about the barriers, especially when it comes to political forces. But that is why global lean is going to be interconnected. We're going to globalize as we deglobalize. So, Jane, thank you. And again, anyone wants to share perspective from your own country institution, we would love to hear from you. Next up, I will sell another incredible slide, because this one I'm looking at right now, and I'm like, Colin, James, something tells me without even looking at the words that we're going to be talking about tech and AI. Am I right or am I wrong?
Yeah, you're right, Alok, and it's great to be here. I think, you know, this is what we're going to talk about here is really a global phenomenon. Every system, as folks know, is designed to get exactly the results that it gets. And right now, our systems are designed, they're perfectly designed, in fact, for burnout, inefficiency, and missed opportunities. So take a look at the manager on the left here. This isn't about bad luck. We've all been there. It's the predictable outcome of misaligned priorities. Leaders today, they're reacting to issues instead of solving root causes. They're caught in a vicious cycle. Here's the irony. It's making things worse, not better. So the question isn't whether we need a better system. It's, do we have the courage to build one? So the next concept that comes to mind is one from Deming. He taught us about, you know, innovation being about challenging the status quo. You know, a mentor of mine, John Shook, showed us that solving problems requires understanding the system. Many of the speakers at this conference have reminded us of the need to adapt continuously. AI is a tool that does that. It gives us a way to rethink how work gets done. It doesn't just make things faster. It eliminates waste, moving us from the emails and the meetings to Gemba and action, right? This is lean thinking at its finest. It helps us see things and see the system more clearly. It's not about replacing leaders. It's about amplifying their ability to make better decisions. And in so doing, AI helps leaders focus on what matters: developing people, improving their processes, delivering value for their patients or customers. So I want to paint a big picture. Imagine a world where leaders at every level aren't distracted by noise. Instead, they're solving systemic problems and improving outcomes. AI enables that world. You know, the woman on the right side of this screen, she's benefiting from a system that is designed to support her. She's leveraging AI to create clear, repeatable processes that free up her time to lead. This technology can amplify the very things that make us human, right? Creativity, connection, right? Thoughtful problem solving. So AI doesn't just help us tackle today's problems, it helps us see tomorrow's opportunities. And, you know, as Deming said, it's not enough to do your best. You must know what to do and then do your best. And AI gives us an opportunity to do the right things and do them well. The question is, will we use it?
Colin, thank you. You know, I like how you've got these subtle hints too. I mean, because my guy over here is also like hunched forward. He has this thermal scrub look, and our efficient AI-assisted healthcare professionals like sitting upright and just glowing. So, you know, you've got some subliminal clues out here that kind of illustrate your optimism about AI. And I wanted to ask you, are there any specific AI tools or use cases you have seen that you're excited about, especially when it comes to creating a more efficient workplace?
Yeah, no, I think about, there are many. And I think one example is how I've worked with my team to essentially build a digital extension of some of my coaching capabilities. And, you know, I've helped them use things like ChatGPT to gather information, to send that information to me as their manager. It helps us problem solve and have deeper discussions about the nature of what's really impacting them. Also, we can have a bit of fun with it. You know, they've taken what I've given them and iterated on it. And now we have a system for not only, you know, identifying the problem, but communicating it with other stakeholders and spending more time on the change management piece, getting folks together, getting folks to work together to solve problems. So definitely recommend that folks use this to solve operational escalations and things like that.
Yeah, and I would love to see asking for patient records and not get a stack of 300 pages faxed to me. I feel like that's an AI solvable problem. And, you know, I know people out there have a lot of different use cases that they've either seen or they've been able to work with, and we'd love to hear from all of you in Q&A. And I'm sure that we're going to circle back to AI, like one of the hottest topics in healthcare at the end. But I want to quickly move on. Thank you, Colin, to the colorful open table presented to us from Jakaria Stewart.
Thank you, Alok, and thank you to Denise and the team for the invitation. My approach is a little different, so I'm going to ask you to reflect as I talk. I know we've been kind of racing through, but I really want you to be thoughtful about what we're looking to illustrate. So if you could just take a moment to quiet your mind, close your eyes, take a few breaths to relax. So I want to ask, when we talk about coming to work and being your best self, what is your superpower? What do you bring to the organization, your teams, and your customers that add value? Now, if you're having a tough time with this, I would ask, what's the one thing in your organization that the people come to you for every day, all the time? You're the person that does X, Y, Z. I want you to know this because it's important. It's your brand, whether spoken or unspoken. We all have them. So I hope everyone now has grabbed a hold of that superpower. Now, I want you to pull into your mind an exceptional multidisciplinary team that you've been on. I'm sure the team members all had unique skills, capabilities. The team was super high functioning. So what were those accompanying superpowers from your teammates? I know people come to me for executive coaching. They come to me when issues are sticky and they're not sure how to have that crucial conversation and how to get leaders to move forward. So what were those other skill sets on that team? And how would your outcomes have changed if you didn't have diversity of thought? How would the process of forming, storming, norming, and performing been different? Would you have been able to accomplish what you did without the full team? My bet is probably not. So my message is simple. Don't be closed-minded. Don't be afraid to have other voices. We're at a lean conference, but let's be flexible with our methodologies, our perspectives. Have them all at the table. Now, I know it slows you down, They could derail your plans. They're not thinking like you are. They're not in your camp. But the world today is changing, and we need new thought, innovative perspectives, and in-touch improvers to engage like never before. So that's my challenge. Have a seat for everyone at the table. Manage your table so it's effective, and don't be afraid to invite diversity of thought, of roles, or of capability to your table. There's so much that we can learn from one another. So I hope that after taking a moment to reflect with me tonight, today, or in the morning, wherever you are, you'll walk away and understand the importance of being open. Thank you.
Denise, I know a lot of cameras are off, but something tells me that you got the same slow clap standing ovation that we had in person. Thank you for sharing that. You know, we can look at the text definition of lean and we can look at these bullet point goals, but without that diversity of thought, I don't know how we get and how we achieve this. You know, I want to ask you almost like a two-part question is if you have a specific example of a situation where diversity of thought was allowed and it improved net outcomes. And that's part one of the question. And part two would be, are you optimistic about the future of there being more diverse representation at the table in leadership and executive levels at institutions?
Yeah, so I think almost everything I touch has a level of diversity at the table because I refuse to move forward without it. I know what happens when we're in a homogenous environment. You're a stalemate. There is no open box. There's no open thought. So if we're all coming to the table already deciding what the solution is and moving forward, we're not going to be innovative. And I love innovation and breakthrough. I don't like incremental is great, but I want to kill it. I want to knock it out of the park and make people look back and go, where would we be if that team didn't get together and figure it out? So for me, it's critical. You know, we have our tools, our RACIs and all those other sorts of things, stakeholder analysis. That's the first thing I do. It's like, who's not at the table? Not just from a role perspective, you know, you need the front line, you need executives, you need sponsors, but you also need people with skill set that maybe no one has used before. I am a leader for our ERG at our organization. And every time we have a meeting, I find out someone has a new superpower. And we dive into it, we develop it, we grow them. And it only works for the entire team to the greater good at the end of the day. So I will say that, yeah, I'm getting excited. Tell me the second part of the question. I was going to go like.
I was just asking if you had a specific example or a use case just to kind of get everyone even more amped than they already are.
Yeah, well, I'll tell you, it's interesting because when you're working with executives, a lot of times they come with their crystallized thought or perspective to the table. And so I just want to challenge every consultant, every person who loves improvement, every person that's looking to make a difference, to have the primary goal to understand everybody at the table and see how you can help them think differently. Because you're making everybody a better person as soon as you get them to be okay not being comfortable and looking at the world without blinders. So not a specific example, but again, a practice that I try to take on in every meeting, in every situation.
Thank you. Oh my gosh. So we have 7 minutes left, and I'll be honest, I feel like we could talk for another 2 hours, and that is already being reflected right now in the chat and in the Q&A, which is great. I just want to encourage people to continue to use that as we talked about something. You know, I have a couple of questions that have already come in. I want to ask, you know, this question, I almost want to pose it to all of you. And the question is why do we feel when it comes to waste, when it comes to the picture that Dr. Evans was describing with waste dripping on the wall, why do we feel like healthcare is vulnerable to this persistence of waste? We've seen this lean methodology in diet culture and fitness and even home organization and in manufacturing. Why is it that healthcare is the industry where it's so hard to remove waste?
I'm happy to have a go at starting that, which is, I actually think we have a culture of solving problems really quickly, or not solving problems properly, just taking action. We don't take the time to actually sit back and intentionally identify our wastes, build a program, a prioritized program of where we're going to start to remove waste, and then have a connected, holistic benefits framework that incorporates quality outcomes, patient safety outcomes, patient experience, staff wellbeing, and cost. So we actually need to intentionally build a balanced portfolio of clinical improvement and process or waste-based improvement as an intentional prioritized program to take forward that ends with a financial element associated with all of the other benefits that we can then not just measure on a spreadsheet, but actually work with our finance departments to be able to identify if you're not spending that money or you're reducing the cost of delivering a particular part of care, how and where are you going to see it in the balance sheet so that you can take it out and intentionally spend it on something else? I've written a few papers, and my papers have got that framework embedded in it. But to do all of that, you need to take account of those, we can either call them barriers or contributory elements that actually are stopping people. But you actually have to start with a mindset and an intentional action to do something differently.
Can I add to hello? Oh, you go ahead, Jikaria.
No, I was just going to add that I love that, Jane. And I want to add that the other component of it is our people. We talk about HRO journeys, we talk about culture of safety, but if people don't know that we actually want them to speak up, that there is no sort of repercussions or anything like that for actually identifying problems. Like, we want problem heroes, we want problem champions, we want people to have a voice. And so a lot of times, even if our systems are in place and we have great financial acumen, if the people aren't ready and comfortable in their environment to be able to say, I see something and I want to help do something about it, then it's very difficult to either start that movement or create or sustain it.
Terry, did you want to add something to that, Terry?
I'll just add very quickly. You know, I don't think healthcare is unique, but it's certainly one of the hardest organizations that we've seen for the application of what we talk about as lean management, managing by means, whatever you want to call it. You know, you also think about government, you think about education. These are other sectors where it's been, you know, much longer to adopt than it's been in manufacturing. And I think you can kind of look at that and you can kind of see some similarities. In healthcare, I think one of the largest problems that we have is you know, sort of there is resistance to change, but it's really hard unless you look to see the waste. Jane and I had that conversation together years ago about the waste dripping off the walls. And what we were talking about was you don't see it. I didn't see it when I was a resident until all of a sudden we started talking about it. And then when you start talking about, you see it dripping off the walls, and the challenge goes from, oh my gosh, I didn't realize that it was there, to now what am I going to do? I feel like I'm drowning, right? And how do I address the system on that largest scale? And I think that's the second element is that an individual actor in healthcare has a really hard time making that change. And so I'm hoping through venues like this, we start to get groups of leaders, executives that are willing to do the hard work of adopting a modern management system where we can manage by our means, and we can continuously improve on behalf of our patient.
I'm into it. We have time for like 2 questions. We might have to be rapid fire. I really want to read this one because I feel like this is touching on an important point. Jikaria, your name resonated when I read this question. Not discussed enough is how a culture of ownership is a necessary foundation for lean, especially in healthcare. Alaska's native healthcare system has some of the best healthcare outcomes after native population took control and implemented lean and integrated indigenous culture. It's referred to as a NUCA system of care. What do you think of community ownership and culture of ownership as part of all of this? Anyone have a burning answer or a response to this? Regarding, you know, looking at a population we're trying to treat, culture and their sense of community, and implementing that into the healthcare system. Yeah, knowing that we're ticking down on time, I will say, you know, in our care experience areas, we, you know, don't create my plan without me, don't, you know, right? So this idea that if we try and go into places and fix things for people and do things to them, not with them, we're failing. We've got to make sure that we honor that. So.
Hello. Sorry to interrupt. I know the discussion is going really well. We have to stop. We have a hard stop here.
I think the orange chameleon wants more.
Thank you for the sharing. Thank you. And you can continue the discussion on the lobby. People are there. But now we will continue the agenda here on the main stage. Thank you.